The human shoulder is just an incredible piece of engineering. It lets us throw, reach, lift, just an amazing range of motion. But that same mobility creates a kind of hidden vulnerability. And today, we're going to talk about one specific, unsung hero in the shoulder, a nerve that, if it gets damaged, can bring that whole system to a grinding halt. So, have you ever seen this happen? An athlete takes a really hard fall, maybe dislocates their shoulder, and then all of a sudden they just can't lift their arm. It seems so dramatic. Well, the reason often comes down to one single, very vulnerable nerve. And that's our whole topic for today, the axillary nerve. Okay, so probably the easiest way to wrap your head around the axillary nerve is to think of it like the main power and data cable for your shoulder. Simple as that. It supplies the electricity to some really key muscles, and it sends all that sensory information back to your brain. If that cable gets cut or damaged, the whole system just shuts down. So yeah, here it is. The axillary nerve has the, let's say, unfortunate distinction of being the most frequently injured peripheral nerve in the shoulder. And its job? Well, it's absolutely critical for two movements you probably do 100 times a day without thinking: lifting your arm out to the side and rotating it outward. Without this nerve working properly, those simple things become almost impossible. So why? Why is this nerve so easy to injure? Well, it all comes down to its anatomy. I mean, the path it takes through the shoulder basically puts it right in the line of fire. So let's actually trace that route, because it's pretty risky. All right, so it all kicks off here at the brachial plexus. You can think of this as the main circuit board or maybe a major nerve highway for your entire arm. The axillary nerve is just one branch that comes off the super complex network, specifically from the C5 and C6 nerve roots, and from there it begins its journey down into the shoulder. And here's where the trouble really starts. Almost immediately, the nerve takes this super sharp turn, like a tight exit ramp off that main highway, and it wraps itself right around a part of your upper arm bone, the humerus. And that spot is called the surgical neck. That right there, being snuggled up so close to the bone, that's risk factor number one. But wait, there's more. As if wrapping around a bone wasn't risky enough, the nerve then has to squeeze through this really tight anatomical tunnel called the quadriangular space. And I mean, it is a crowded neighborhood in there. It's bordered by muscles and bone, making it a critical choke point where the nerve can easily get pinched, stretched, or compressed. So after it navigates this whole obstacle course, where is it going? What does it actually do? Well, it's heading to two main targets. It powers up the big deltoid muscle. That's the one you use to lift your arm away from your body. And it also powers the smaller teres minor, which is a key rotator cuff muscle that gives you stability and helps you rotate your arm outward. So let's break that down. Two big jobs. First, you've got motor power. This is the juice that lets you do things like reach for something on a high shelf. And then, second, you have sensory feedback. The nerve provides the feeling to this one little patch of skin on the outside of your shoulder. It's often called the regimental badge area, because of where a military badge would sit. And if that area goes numb, that is a classic telltale sign of an axillary nerve injury. So, with a path like that, it's probably no surprise that there are a lot of ways for the axillary nerve to get hurt. And these injuries can range from really obvious, high-impact trauma to, well, much more subtle, hidden pressures. Yeah, the top culprits are pretty much what you'd guess. A shoulder dislocation that just violently yanks on the nerve, or a fracture of the humerus, right where that nerve is wrapped around it. But look at the last two on this list. Quadrilateral space syndrome, that's when the nerve gets squeezed in that tight tunnel we were just talking about. And this one's a shocker. Even something as simple as using crutches the wrong way can put constant pressure on the nerve and cause a serious injury. And this really gets to a crucial point, highlighted in the source material we're looking at. We tend to think of these injuries coming from some big, dramatic event. But sometimes the cause isn't obvious at all. The nerve can get inflamed or compressed without any clear reason, a condition that's sometimes called brachial neuritis. It's a real mystery sometimes. Okay, so what happens if you do injure this nerve? Is it game over? Well, the good news is that a lot of these injuries actually have a really good chance of recovering, many times without even needing surgery. So let's walk through that typical road to recovery. So the first line of attack is what's called conservative treatment. Now, step one, physical therapy, is really interesting
The goal here isn't to force that muscle to work again. It can't, not yet. It's all about keeping the joint mobile and preventing that big deltoid muscle from wasting away while you wait for the nerve to heal. At the same time, in step 2, doctors use tests like an EMG where they're basically listening for any electrical signs that the nerve is starting to wake up and reconnect.
And believe me, this approach can work wonders. The source material actually brings up this amazing case of a professional rugby player. He re-injured his axillary nerve, which is a huge setback. But with dedicated physical therapy and careful monitoring, he was back on the field in just 2 months. It's just a great example of how well the body can heal if you give it a chance. But there's a really important number to keep in mind here. 3. As in 3 months. This is the critical number. If after 3 months of this conservative treatment, there are absolutely no electrical signs of that nerve waking up, well, that becomes a major decision point. That's when the conversation usually has to shift towards surgical options.
So what if the nerve doesn't wake up on its own? Well, that's not the end of the story, not by a long shot. There are several really advanced surgical techniques out there that can help restore function to the shoulder.
Now, with surgery, timing can be a big deal. The best results usually happen when the surgery is done within a year of the injury. But what's really amazing and super encouraging is that even in cases where the injury is much older, what some might call neglected, there are still procedures that can successfully bring back meaningful function. There's still hope. Okay, these surgical options can sound really complex, but their goals are pretty straightforward. Let's break them down. Neurolysis is basically just freeing the nerve from any scar tissue that's trapping it. A nerve graft? That's like building a little bridge to patch a gap in a nerve that's been severed. A nerve transfer is super cool. A surgeon literally reroutes a less important healthy nerve and plugs it in to power the deltoid. And finally, if the nerve is just too damaged, a tendon transfer uses a nearby healthy muscle and moves it over to do the deltoid's job of lifting the arm. And here's the real-world impact. Let's take that tendon transfer. Even in those really difficult, older injuries, a normal shoulder can lift or abduct to about 150 degrees. After the surgery, patients got back an average of 78 degrees of motion. Look, is it perfect? No. But for someone who started at 0, who literally couldn't lift their arm at all, 78 degrees is the difference between dependence and independence. It is absolutely life-changing.
All right, let's boil it all down. What are the big takeaways? First, the axillary nerve is vital, but its risky path makes it incredibly vulnerable. Second, the good news, most of these injuries can and do heal with just physical therapy and patience. Third, that 3-month mark is the crucial checkpoint for deciding what to do next. And finally, even for the most severe cases, there are fantastic surgical options that can bring back a lot of function.
And that kind of brings us to a final thought. This whole journey, this whole story of one little nerve, it teaches us something pretty fundamental about our own bodies, doesn't it? The shoulder gets its incredible mobility at the cost of stability. And that trade-off is what puts structures like the axillary nerve at constant risk. It's just a fascinating peek into the beautiful and sometimes pretty fragile compromises that make up human anatomy. And hey, if you want to go deeper, all of this came from a really comprehensive review article from the Journal of Orthopedic Reports published in 2022. We really hope this explainer gave you a new appreciation for some of the unsung heroes working inside you right now. Thanks so much for joining us.